Welcome to another episode of the Health Heal Thrive podcast. We are here with Dr. Shamistra Barathan, is affectionately known as Dr. Shami. Thank you so much for taking the time to chat with us today.
Thank you, Tracy.
It's the first time I've interviewed you, even though I know we've had quite a bit to do with each other, and I absolutely love the work you do. Just tell everyone a little bit about, I guess, integrative, functional GP. What does that look like?
I love that question because I get asked it all the time. And it is confusing, actually. It's like, oh, what's the difference? So, normally, what I say to patients when you go and see your GP now, what do? You go in and you give them some symptoms, and often they just go, let me just talk about one symptom. And often the solution is a drug. And so, what we do in integrative or functional medicine is like, hold on a sec, we need to look at your entire body. We need to look at all of your symptoms because often they are all connected. And as a result, we need to go into the root cause and find out why. We always ask the question, why? Why are you unwell? So we hit the root cause and we look at you holistically when we treat you. So it goes back down to what are you eating? How are you sleeping? What's happening in your life? What do you do all day? Are you spending all day indoors? And how nutrition, lifestyle, and affects our health. And then we work together in a very step-by-step approach. It's all about getting results. How can I get you better as quickly as possible? And we put a plan into place. It's very holistic.
Is that something you've always wanted to do? Is that why you went into medicine?
So funny you say that. When I look back, I woke up 10 years ago. I was I was literally in this tunnel of, because you go through med school and there's a lot of fear-based learning, there's overwhelm, and you come out going, right, I need to know illness. That means this is the drug I treat. And then you go through training. And in the training, it's all about drugs. It's all about, right, how do I identify an illness and how do I treat it with the drug? And that was the focus in every part of our training, from med school to GP training to hospitals. So when you're starting off, you're going, hold on a sec, I'm literally prescribing. What am I doing for this patient? I don't even have time to listen about their life and how that's impacting it. When I was in the early days of doing GP, I would think, oh my God, I don't even have time to ask how they are, because it was like 6 or 7 minute appointments. It was about 40, 50 patients a day. GPs are overwhelmed, patients are overwhelmed. And I was incredibly disillusioned. So, funnily enough, after GP training, I actually had to take time out, and I took a year out, traveled, did a bit of charity work, did something completely different because I was totally disillusioned with the whole system. And that was the start of my awakening. And then I moved to Australia and I realized, wow, I can spend more time with patients. I can actually get to know them, and how learning about their life and about them can make a difference to the management plan. And then I encountered Australian College of Nutrition and Environmental Medicine through a good friend. And that's when, wow, the light bulbs went off. And I go, this is medicine that they forgot to teach us in med school. And from until this day, I'm actually still learning a whole new medicine because there's so much to learn. Like every week, there's something that I've just added to my skill set, because I go, wow, now I'm going to include that, because it's stuff that has not been taught and I can understand because it's all pharmacology focused. When you can actually do a lot of healing through lifestyle, diet, it's just quite phenomenal.
Amazing, amazing. I can imagine it would have been quite confronting too. Like I think, there's a lot of similarities with coaching. I sort of think, well, my coaching work's never done. I'm always learning. I'm always, trying new things, coming up with new things, because it is like that, right? We never know, we're never ending with our learning. But when you're faced with a choice like that, because I can see some people would look at that and go, oh, that's too hard, that path. It's actually probably easier in some ways to just stick to what I know and to stick down the pharmacology path. Did you find it a little bit scary to step off into that different path?
It's funny you should say that, because when I speak to colleagues or GPs, they are scared to step
Mm.
off that path. But I was just embracing it, because when I saw the change in myself, and then I had to share it with patients, and then when you see the change in patients, you cannot stop. You can't actually deny this kind of care to patients when you see them feel so much better with simple tweaks of nutrition or lifestyle or nutrients, just that tiny tweak. And it always blew my mind. Such a small change can make a massive impact. And when I see patients suffering for years and they can turn around in days, I go, you cannot deny this. So it was not fear at all, but what it is, we've just got to realize medicine is outdated. Medicine is outdated. When I think about it, when you go through med school, the textbooks are 10 years outdated. To be honest, I have to say it, doctors, need to constantly learn. What we learn about heart disease 10 years ago is different now. We can actually never stop learning. So if someone says, this is what I've known for 10 years and it's too scary to learn something different, they've really got to rethink about what they're doing. And that's how strongly I feel about it, because things are changing all the time and we have to keep on track, because it's not fair for a patient to be denied that kind of care just because you've decided not to embrace.
But there's so many barriers, isn't there? I mean, you touched on the fact that, you sort of felt burnt out. I'm using air quotes because I don't know if there was an official burnt out, but you sort of felt like you need to take a break. I've just had 2.5, 3 days in a public hospital with an acute appendicitis. And honestly, I sat there watching. I was in a room with 3 other people, all there from type, diabetes complications. A man had his 3 toes removed and, just very much passive, I think, victims in a lot of ways, no empowerment with their health. And I realized in my time that I was there, because I think intellectually knew this, but when you experience it, I think you get it on a different level, that there is nothing about healthcare when it comes to hospitals, certainly hospital systems. It's so under pressure. These people that work there, good people, they're so under pressure. It's medications, it's pain management, and it's getting you out the door. I mean, there is nothing, to do with wellness. I laughed. I said to my group, I actually had to come home to get well. Aren't I lucky that I know that? But most people don't. So how does someone who, is it a case of you have to really empower yourself to make different choices with who you go and see in terms of
Oh,
healthcare provider? Yeah.
absolutely. And I actually, when you really reflect, if you have no idea about the healthcare system, I feel for you, because
Mm,
you have to take the power back. You have to learn how to keep yourself well, because it's not happening in the health system. They're not teaching you how to be well. When you go and see a usual doctor, there is no time for education. To be honest with you, doctors are not taught how to keep patients well. They're not taught about nutrition. They're not taught about lifestyle medicine. So it's the doctor's initiative to go, I need to know this, and they go off and do extra study in their own time. But it's not in GP training, it's not in med school training, it's not a priority. So it's up to the patient to go, actually, I need to know about this. And there's
mm,
a lot of resources out there. So many doctors are speaking out in terms of podcasts or online training, or hundreds of books out there. But it is confusing. It's still really confusing. So it's finding that, hence why I went into integrative medicine. I could give more time, give more education, and empower patients to say, now you've got the tools, you can go off and lead a healthy life. And if things happen, we're here for you to
mm,
guide you back, but you're in control. And it's important to empower the patient. So gone are the days where knowledge was solely in the doctor's hand. And that's what doctors have to realize. Actually, patients read a lot. They actually know probably more than you about weight loss than a doctor. So it is going, let's have a collaborative approach. Let's talk about what you know, what I know, and I can use my experience as a doctor to go, actually, this makes sense for you. Let's
It's
get you
such a paradigm shift, though, isn't it? From the old days when doctors
there.
were kind of gods and, looked up to. And there's still, like, I look at the older generation, they still very much, well, they just told me to do this. There's no questioning. It's just, I'll listen to the doctor and do what you say. But yeah, that just it's not working. It's not working. We have to empower people to ask the questions. But you made a comment how, knowledge used to be kind of, it was very much only in the hands of a few people. And I think it's, my husband says we've got the Library of Alexandria on our phone now. I mean, we have access to so much information, but I think that can be a curse sometimes too. One of the things I wanted to ask you is, you talk about root cause. See, root cause can look very, very different to, depending on who you're talking to. So how does one person go about finding out, what's true? Because there seems to be so much conflicting information out there.
That's a big question.
Mhm.
But I get what you mean, because when they come and see me, and they will present with a couple of symptoms, whether it's anxiety, tiredness, gut health, weight gain. And it's really interesting because just from experience and the knowledge, I can say, actually, do you know what? We need to start with anxiety first, or we need to start with gut first, or we need to actually start with metabolic health and weight. But it comes from that experience, and also I guess our training as well of like, right, what are the red flags? That's what we need to rule out. In your story, this is where we need to start, because when we sort out anxiety, I think your gut's going to settle, and it goes in that route. But it takes experience. So it is a matter of guidance. And that's why it's really important to find a good practitioner who can guide you on it, because you can't self-diagnose. You can't, when it's that complicated, you can't actually be your own doctor. It's great if you go, right, I think I've put on a bit of weight, really simple strategies. Maybe I've read a great book on metabolic health, and you can actually do a lot by yourself, whether it's, do you know what, I've realized I've taken too much sugar, I'm eating too much, I'm becoming more sedentary, I'm not drinking enough water. There's a lot you can do with that knowledge base, and you can see change. Absolutely, for sure. However, when it gets to a point of resistance and you go, actually, I'm still not losing weight, or I'm still not feeling better, that's when you go in, and that's where we can go much, much more deeper, whether it's looking at blood tests differently, really supporting nutrients, and then going deeper and deeper. But my philosophy is, start simple, get the basics right, get the foundation right, and often we see change.
I love that. So what would you consider as being these foundations that are most important?
Absolutely. The first question I always ask is like, what's your day like? How do you start your day? How do you feel? What does stress feel for you? Because from my experience now, everyone relates to stress in a very different way. Some go, oh, I'm never stressed. This is great. But they're doing 12 hours a day in front of a computer, indoors, hardly any time for walking or even sunlight. And I'm like, oh, I love it. This is great. But hold on a sec. Why are you still having gut symptoms? What's going on there? Like, the connection between stress and gut is not there, because they've normalized stress. They've normalized this way of functioning, but they are breathing shallow. Like when they're checking that 200 emails a day, they might be even holding their breath. So it's literally looking at the entire day and getting that foundation right of breathing. That's number one. I see a lot of patients who shallow breathe, they're kept in that fight or flight response. Next thing is addressing stress. What does that look like for you? Are you internalizing it? And I can give you an amazing example. Just recently, I saw a patient who came to see me, and he was slim, great fitness, loves his job. It's high powered. He flies it once a month. He's got this amazing sort of picture perfect life. But he came to me just for a checkup, and he had skyrocket high blood pressure. And I go, hold on a sec, what's going on here? I had to actually send him to hospital because it was too high.
Wow.
And never put high blood pressure with his physique at all. And he hadn't checked it for months. He was actually going through a lot of internal stress. His relationship was crumbling. He was internalizing it. He put on this amazing face. And then when I said, look, you're going into hospital, is there anyone I can call to be with you? And this was really profound, Tracy. He goes, no one. Absolutely no one. His family was in another state. He was obviously arguing with his wife, and that was a cause of a lot of his stress. And he wasn't able to turn to friends, because he goes, this is not something I talk about. We just don't talk about issues.
That's
And then it
sad.
really, I stopped and think, I go, wow, I wonder how long have you been under so much stress that your blood pressure is so high that can actually give you a stroke or a heart attack. It was that high. And he was kept in hospital for, maybe 7 or 8 hours while he was put on blood pressure tablets. And, we're following it up. And people don't realize the impact of stress. It can give you a stroke. It can give you a heart attack. It is not only about cholesterol or diabetes, and the impact of stress is huge on the body. And I'm now reflecting, going, I think you've been in this state for months. So what is that actually doing to you? And he presented with, I just want to check, my kidney doctor says it's just gone down a bit, and I just want to check on my kidneys. And that's how it all started. But he looked fit and well. And that's what I always think. You can have this picture perfect life and physique. A lot of things can be happening inside you. And
Mm.
it's really important just to understand the impacts. Now I think I've sidetracked. What's the question about?
I don't know. It was the foundations.
Yes.
So yeah, so stress, obviously your inner, I talk about it like your inner terrain, your inner world. Like until we start to look there,
Yeah.
we've got no idea a lot of the time that it's on this heightened
Yes.
trajectory. And yeah, like you said, it becomes normal. Like our sort of tolerance level just goes up and up and up and up. And it's not a good thing because because then, as you say, all these systems start to sort of not work properly for us. And the stress is really important because it is such a thing, or, particularly for men, we can't acknowledge that, we're struggling, or we can't seek help, or how great he landed upon you and was able to, get access to the information he needed around all of that and get the help he needed. But I hope, that sign of community and connection and having people around you, I mean, that is part of health too, right?
Absolutely huge. And I always ask, do you have a great social network? Who do you talk to? Humans need to regulate emotionally. So that's part of the foundation as well. We've got to look at mental health. It's
Mm,
so important how the mind affects the body. And it's connected. In medicine, they disconnect it, but it's so connected. For example, irritable bowel syndrome is connected to stress, insomnia, poor sleep, anxiety, weight gain, high, diabetes. It's all connected to stress. It's quite scary.
yeah. And to me, it sort of highlights the importance of saying that it's not just one thing. I talk about this one-dimensional, sort of world we tend to live in. Oh, if I just change my diet, then I'll be fine. Or if I just start exercising, I'll be fine. Or I just start fasting, I'll be fine. Or I just start, I don't know, meditating once a day. Or I don't know. Like I think it's seeing that, yeah, there's multifaceted, things that we have to look at, but that can be overwhelming at the start, but we don't have to do it all at once. And having someone like you to sort of guide us as to, okay, we're just going to look at this now. I mean, everything else will be sort of influenced, but, we don't have to look at it all at once, and we don't have to be perfect. We don't have to address, everything at once. Do you?
And it doesn't work if you do that. So I
No.
sort of say it's a journey that you're going to start on, just planting the seeds, you're gaining that information. And when you understand why you're doing it, but I also want you to feel it. I want you to feel the benefits of, oh, what happens when you don't drink so much coffee? What do you feel? And once you get that positive feedback, you're going to naturally want it more. So example, you've had a beautiful walk in the sun in 15 minutes, and how do you feel? And this is really important to understand the feedback that you're getting out. And I often say to patients, now you're so conscious of what you're doing in the day, of consciously choosing what you eat, consciously deciding that you're going to take a walk rather than living on autopilot, which often we're doing when it gets so busy and so stressful. You go on autopilot. So you're now shifting to conscious living, and great, enjoy it, and feel the feedback, because you're going to be empowered to actually say, actually, I need that 15 minutes of walk every day. I need to meditate. I choose not to eat this food because I don't like the way it feels, rather than being dictated on what to do. And that's just phenomenal, because you feel so empowered and you go, actually, I love the way I feel now. I want more of it. And I now get patients say, God, I'm addicted to feeling healthy. I'm addicted to feeling well. What else can I do?
I love it. I love it. That whole change of I have to do all this stuff to I want to do it. I think that's the shift, that really changes the way we show up to life. I love it so much, Shami. Love the work you do. You are coming to be a part of the Lived Experience workshop in Melbourne in June. I would love you to share a little bit around what you're going to bring, what you're going to talk about at the workshop.
Yeah, so I love talking about burnout because I think we don't talk about it enough. And we've come into a time in society that so many people are going through and they don't even realize they're going through it. And I'm talking, even psychologists. I've got so many psychologists on my books who did not realize that they were going through burnout. And so this is where it's so important to first bring that awareness to the forefront of what does burnout even look like. But more importantly, I'm going to talk about the 7 key strategies to preventing burnout. Why do we need to wait until illness arises? For example, that really high blood pressure, or just feeling so fatigued, so depressed, so negative that you don't want to go to work the next day. Why do we need to wait to the point when you stop and say you just have to make change? We can actually so much before that even happens. And why not live a life where you're thriving and excited and finding joy, rather than just waking up going, I need to get to work. I have to get to work. And let's start shifting that narrative that life doesn't have to be stressful. It's our response to it. And these 7 key strategies are so simple. They're free. It's so easy to implement that we forget how quickly we can feel better. So I'll go through those 7 key strategies and you can start implementing it straight away, and have that great discussion and meet other people who feel it. And I think the power of groups is so powerful as well, to say you're not alone. I think society's created this environment where stress is celebrated, and we need to really change that narrative. And that's what I'm really passionate about. We need to start celebrating. Oh, great, you didn't do anything this weekend. Fantastic. You are working 3 days a week. Kudos to you.
Mm.
Let's shift that narrative, because you can still thrive on doing less. And we need to really shift that narrative. We don't have to be busy all the time, because the human body is not designed for that at all.
Gosh, I love it so much. The busy badge, so much tied to that, isn't there? That we when we look, we will see that, it is this illusion that we hold to, that we just don't need to. And I love what you share on Instagram. I've seen you being at the beach and being camping and being in nature, and really trying to get people to see that exactly that it's not work, it doesn't have to be work all the time. And it's interesting, isn't it, how you say that so many people aren't even aware that they might be suffering from burnout. And I just think it's that awareness is everything. And what you talked about before, this automatic pilot that we tend to sort of go in just to try and get through our day. I think if you're just trying to get through your day, there's something there for you. And coming along and listening to what you've got to say, or even going and make an appointment to go and see you, Dr. Shami, and just really see what you can't see. I think doctors like you are a gift. I know you actually help other doctors too. You mentor other doctors, is that right?
That's true. And, I really want more doctors to come down this pathway. It's so fulfilling, not only for the doctor, just going to work and seeing patients get better and on that journey. It's so exciting. This is what medicine and health is all about. I see a lot of doctors go through burnout. In fact, a colleague of mine, she joined this Facebook group, and it was 1,000 female GPs in Australia all going through burnout. And
Wow.
it's just shocking. And she has only been a doctor for about 5 to 6 years. And I go, okay, what's wrong in that? What's wrong in that story? Something's really wrong. We need amazing doctors like them. So why aren't they surviving the system? And so the system must be wrong. And it is actually a lot of issues in that whole understanding what health is and what the role of the doctor is, and how we can help the patient. And it's moving towards more of a health coaching, way of empowering the patient, providing knowledge so the patient is empowered on how to stay well. And yes, the doctor is there. For example, in your case, Tracy, the doctor is there when things are in the acute stage. But there's a lot we can do in chronic disease to prevent it.
I love it so much. And all you need to be is curious, don't you, to
I love that. Yes.
explore. So whether you're curious to explore with Dr. Shami, if you're listening and you think she can help, please reach out. I have all her contact details below. If you are in Melbourne or not, you want to come and have a trip, have a weekend in Melbourne in June, because even though it's freezing, the place will be warm. And I promise you it'll be a weekend that you will, you won't forget it. It's going to be such a wonderful weekend. Thank you, Shami, for coming and talking to us today. I can't wait to see you in June.
Amazing. Me too. Thank you.